How does the IES-R compare to other PTSD screening tools like the PCL-5? When it comes to understanding post-traumatic stress disorder, or PTSD, two commonly used screening tools are the Impact of Event Scale Revised and the PTSD Checklist for DSM-5. While both are self-report measures designed to assess PTSD symptoms, they have distinct differences in their design and clinical use. The Impact of Event Scale Revised, or IES-R, was created to align with earlier diagnostic criteria for PTSD, specifically the DSM-4. It consists of 22 items that focus on three main symptom areas: intrusion, avoidance, and hyperarousal. However, it does not include some of the newer symptom domains introduced in the DSM-5, such as negative changes in cognition and mood. This means that while the IES-R is useful, it may not capture the full range of PTSD symptoms as defined by current standards. On the other hand, the PTSD checklist for DSM-5, or PCL-5, is explicitly designed to reflect the latest diagnostic criteria. It covers all four symptom clusters of PTSD: intrusion, avoidance, negative alterations in cognition and mood, and alterations in arousal and reactivity. This makes the PCL-5 a more comprehensive tool for assessing PTSD symptoms in line with the most recent guidelines. When we look at the psychometric properties of these tools, studies show a strong positive correlation between the scores of the IES-R and the PCL-5, with a correlation coefficient around 0.86. This suggests that both tools measure PTSD symptoms effectively. However, the IES-R has shown less correlation with symptoms of depression and anxiety, which supports its specificity for PTSD. The factor structure of the IES-R can vary, and it does not fully align with the symptom clusters of the DSM-5, which may limit its effectiveness in capturing the complete PTSD symptom profile. In terms of practical use, the IES-R is a brief and easy-to-use questionnaire that is widely utilized in research and population surveys. It is primarily for screening and assessing symptom severity rather than for making a diagnosis. The PCL-5, while also a self-report measure, is often used in clinical settings for both screening and supporting diagnosis, thanks to its alignment with current diagnostic standards. Cutoff scores for these tools also differ. The IES-R has recommended cutoff scores ranging from 22 to 40 for probable PTSD, but these can vary across different studies. In contrast, the PCL-5 has more standardized cutoff scores, which can improve the consistency of screening results. It is important to note the limitations of both tools. The IES-R does not assess all symptoms outlined in the DSM-5, particularly those related to negative changes in cognition and mood, which are essential for a comprehensive PTSD diagnosis. Meanwhile, the PCL-5 may require further validation in diverse populations but is generally preferred for assessments aligned with DSM-5 criteria. In summary, while the IES-R is a valuable tool for screening and monitoring PTSD symptoms, the PCL-5 offers a more thorough and current assessment that aligns with the latest diagnostic standards. For anyone dealing with PTSD, consulting a healthcare professional is crucial for accurate diagnosis and treatment.